Hey, Jay.
Well, hey, Natalie.
Hey, Em.
Hey, Natalie.
How are you ladies doing today?
I'm good.
Good.
Oh,
Good.
wonderful. We have a special guest today that I am so excited who is joining us. And we had the opportunity, I don't know if you guys remember, I know you remember, it's silly, to be on Lance's show.
I know
All
he
Home Care
took on
Matters.
that challenge of all three
He
of
took on
us.
all three of us. I mean, he's
Yes.
got 3 kids, so I think
It's
we're
true.
okay.
Yeah.
So we have Lance Slatton with us, and I am so happy that he's joining us. Jay, why don't you tell us about Lance?
I would love to. So Lance's professional background, because this is important, but then when we get into the goods, his
He's
caregiving,
very important. I'm not going to lie to you. He's impressive, Jay.
He is, I know. So he is a senior case manager at Enriched Life Home Care Services in Livonia, Michigan, with over 18 years in the healthcare industry. He is also the producer and host of All Home Care Matters, fantastic podcast, in case you have not heard it.
Yep.
It's the award-winning podcast and YouTube channel known as the leading voice in long-term care. But what got him to that is a fantastic story. He was married, started an adventure with his father in caregiving, but he was also getting ready to go to med school, and he was looking for another job so he could get more than a nickel raise, maybe, Lance.
A nickel
every year.
I love it.
So we're all pursuing a little career advancement. So Lance, thank you so much for coming.
My pleasure.
So tell us, so you're young, and you're young now, but you're young. You have no children, I guess, at that point, but you're married. Kind of where does your journey begin? Take us back to that day.
So when my wife and I got married, our parents are healthy, life is pretty perfect, and it still is perfect now, but we get a call one evening a year after we're married, and it's actually coming from a registered nurse, and it was going to my wife's phone, and it was a home healthcare nurse, and she had been treating my father for a wound that he had developed. We had no idea that he had this wound or anything like it, and she said, he's not capable of, managing this wound on his own. And my parents were, divorced. And so he needs to maybe come stay with you guys, or we're going to have to place him in a facility. And
Surprise.
My wife's like, yeah, surprise.
Yeah.
Does not even begin to describe it.
Wait, where were you in your life? I need to back up a little farther.
Yeah,
like
right.
you were born and skip forward to past, you're married to your wife. How old are you? And then are you in postgraduate program? Or
so
what? Tell me a little bit.
I'm getting ready to take the MCATs, and
Okay.
I'm working, we're talking about that nickel. It was actually not a nickel a year, it was a nickel a semester.
Oh, that's good. That's better.
So, but to help manage, my course load and my, obligations to the university, I was working in the labs, which was a great job. And then I was doing, student teaching as well. And, it just wasn't enough though. Now I'm married, and, you have a house payment, you have all these bills, right? And it was minimum wage, and, it was great for a while, but it's like, okay, I have a lot more to contribute. I feel like my time's worth a little bit more. And all of a sudden I go to visit with a friend of mine, and he has an office in a building, and he's in the healthcare profession. Says help wanted on the door on the way to his office. So I stop and check it out, and it was hiring for home health care. So I'm asking this guy who's at the desk, the only person in this entire office, what are you guys hiring for? Because I have a clinical background, and I've worked in cardiac critical care, but due to a back injury I sustained, it just wasn't practical or advisable really for me to continue that or take the chances, because it was pretty intense injury and surgery. He has no idea. And so I leave there, and I call my wife. I'm like, I just had the best idea ever. I really literally, I laugh to this day. I thought I invented the wheel. I'm like, why don't we start a company where we can send caregivers into the home to help people like we would need, but that's kind of skipping around with my father's story.
Yeah.
Early on, early 20s, life going on, everything's great. And then we get this call.
Right.
That call really, changed my entire trajectory of my life, even to this day. They said he's not able to manage this wound on his own because it was on the, backside of his body. We can't, take care of that ourselves, any of us. And, she said, I've been coming here for, 6-8 weeks. I mean, we didn't even know he had surgery, let alone, just to give you a little, content or, context for my dad, great person, had a great career, very, very old school mentality. He was in the Marine Corps in the 60s. Marine Corps of the 60s, I tell people, is not like the Marine Corps nowadays. It was a lot more intense. And he just, thought he could manage and push through it. I'm, not going to stop kind of mentality. And it just was not something that he could handle on his own. I mean, he was going to the doctor and things like that. But he also didn't want to impose on us either. I don't want to move in with my son and wife because they're newlyweds. And, he knew how, insanely busy we all were. But we said, family's coming before anything else. If we need to help you or you need to stay here. And that's why he also had the nurse call my wife and not me. Because he didn't, he did not want to, impose or, whatever the case may be. So fast forward 24 hours later, we're unpacking him and he's moving in with us.
Wait a second. So do you have any siblings?
I have a sister. Mm-hmm.
Okay. Are you oldest or youngest?
I'm the oldest.
Okay. Birth matter.
There you go. Thank you.
Thank
you.
Yes.
Yeah,
There you go.
All right. So you got that.
Emily, yes.
And so your sister was then younger. How much younger though? Because you're in your
she's 4 years younger. So I mean,
okay.
she wasn't. I mean, she was still living at home with our mom. I mean,
Gotcha.
Yeah.
And then that's weird. So I think, it would be hard if you think about it, 18, if she were to have to move in, that sort of thing. So what was the discussion like between you and your wife 24 hours earlier? Like she gets a call and it's like, hey, he can't live on his own. And she's all like, okay.
Yeah, actually, and I love my father dearly. There was no, bad, blood there or anything whatsoever. She was probably as close to him as I was. So, I mean, there was not even a split second thought on her side where, like I said, he had the nurse call her, and, she's like, we gotta get your dad here. And I said, of course, but we were just, and the biggest discussion was, why did it get to this point? Why didn't we know this sooner? And I think a lot is to be said about healthcare. There's a lot of flaws there, unfortunately, that, all of us have gone through or experienced in some fashion. And it's like, well, why are you calling us, several weeks after the fact from the surgery, from this wound? And I get, respecting privacy, HIPAA, and it wasn't an emergency situation. But when we talked to this nurse after he moved in, just to get some more background, she's like, well, I would come on, let's say Monday, Wednesday, Friday. And I noticed, it might be a 2-day-old bandage and he wasn't able to change it, or he doesn't have somebody to help him change it. That right there, just being, having a clinical background and just a common sense background.
Well, there is.
I would say, maybe after the first couple of times or even the first time, are you sure you're able to handle this on your own when I don't come to do it? And then reaching out to the family or someone or something, just, why let it go several weeks? That was my thing.
Absolutely.
How old was your dad? I think that's because you're in your 20s.
Yeah. He was 69.
Wow. So I think that's the other piece of it too. I mean, he'd probably, I don't know how long he'd lived by himself, but I mean, and him being a Marine, I mean, I just feel like he mentally, visually see him walking around with like nails and spitting them out kind of thing. Like just like,
that's exactly the right image too. Yeah.
I figured like, I don't need it even. I walked through blah, 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 like, walked across the country with no shoes on.
Yeah.
Okay. So he comes in. Is this a long-term stint? Is this a short-term stint? Like,
It ended up, yeah. Yeah, it was originally well, let's just get this better, get you back on your
Right.
feet kind of thing.
Mhm.
That turned into 2 years. Yeah, so just to give you some more background and context, what had happened is he was doing something, walking or slipped or tripped and fell on his tailbone, just took a really hard fall. That hard fall was hard enough that it developed into a large abscess.
Mm.
So it didn't bruise, it abscessed instead of bruised, or bruised then turned into abscess, however you want to say it. And, I'm fine. I'm still breathing. I'm awake. I have a heartbeat. It will heal. Well, as the story goes, he was driving one day and all of a sudden that abscess decided it was time to pop. So the abscess burst while he's driving. And if anyone knows about abscesses, it's infection and nasty and,
Wow.
it just made a mess. And the odor, not to get graphic, is pretty intense too.
Yeah.
And so he goes to his primary care doctor, who's, a wonderful country doc, kind of the same mentality of the Marines. If your arm's still on, you don't, as long as you're not dying,
Walk
you
it
don't
off.
need any. Yes.
No blood. You're good.
You're good.
And so he goes there and he's like, what are you doing here? You go right to the emergency room, get right there. So he goes there, they do the surgery, and it was a successful surgery. The problem then became, though, he was not able to wound dress, clean, and manage it on his own. That's where I go back to this nurse. Why did you wait several weeks to let us know? But he ended up total with 8 surgeries because of that abscess.
Wow.
Yeah, the infection, tailbone, it's a very meaty part of your body, and it's very pointed, and so the infection ended up getting into the bloodstream. So he's on some heavy duty antibiotics. The infection ended up developing into osteomyelitis, so he got infection into the bone. It gets pretty graphic, so I'll kind of leave it there. Just use your imagination.
Yeah.
But after every surgery, the needs just became greater and greater and greater. And we were there for all of them except for the first surgery.
Yeah.
And so we're watching this, and going into our situation, it's like, I have lab at 12:30. That's 2.5 hours. Then I'm teaching at 4 p.m. And we're worried about him, and we're like, we need some more help. And it's just, it just wasn't there. But the part for me, you guys, that is still to this day the thing I'm most adamant and passionate about, because it's still kind of raw, is, we have one of the best healthcare systems in the world, and I won't use names. They're coming into our house 3-4 times a week. And they actually knew my family personally, because when my dad came to live with us, he was over about an hour away. That was an entire different system. He was with a totally different, provider. When that provider transferred him or handed him off to this new system, they called me, because I'm next of kin, next in line. And we're doing his intake over the phone, normal stuff. And then at the end, this is the nurse supervisor for this healthcare system's home healthcare division. She's like, now, can I ask you something in confidence? Sure. I can't imagine what this is going to be. She goes, do you know A, B, C, D, E? And I said, well, yeah, that's my uncle. That's my aunt. She goes, well, I do want to tell you, full disclosure, I went to high school with all of them. And so I'm thinking this is really great. What a blessing, right? And so I say that to say this was somebody that even knew our family and personally, had a relationship and cared about them. This lady ended up coming to work for our company, as a matter of fact, not too long after that. But we had all those connections and we were very, involved, but still nobody ever presented to us any option, knowing what we're going through, just like millions of other families. Have you got some respite? Have you looked in the respite? Here's some resources. Here's what's available. Reach out to this, reach out. Not a single person. And I mean, we're getting to our wits' end, not because of my dad or, what he's doing, but it's just no matter who it is, what's involved when all of a sudden you're a 24-hour caregiver. And that's to this day, I've never understood why nobody ever said to us, have you looked at respite? Have you considered getting, caregivers in or, anything like that? And it just makes no sense to me. But millions of families go through the same thing.
I wonder, and I know, Em, this was a situation for you, and you can lean into that, but did anybody offer that to you, even in the state of Tennessee? I know the systems are different. Did they offer it right up front, or was it hard to get?
It was extremely hard to get. We had to wait, a good 2.5, 3 months just to get home health, because also the need is great and they just don't have enough employees. That was another big issue. We waited for like a month and a half.
Yeah.
So that was a big issue of the waiting, getting insurance to approve it. It was a lot of paperwork and time.
Yeah.
So Lance, did and like Emily said, I mean, you've said it now, I think so many families experience the wait because there's a shortage of staff. There was a shortage of staff before the pandemic. There's even more it is exasperated by the pandemic. And as we have our baby boomers are getting older, in the next, we're 2023, in the next 7 years, it's going to explode and there's going to be more. And so, but thinking back to your story, you talked to this lady who's home health. She doesn't say to you, here's some extra things that you might do. So you're just getting home health 3 days a week, 45 minutes to an hour, I'm assuming to manage that wound, correct?
Yeah, that's the extent of what we received,
Right.
And then you and your wife are doing everything else.
Yeah. My wife, tremendous, wonderful. I say, next to my grandmother, probably the most godly woman I've ever met in my life.
Yeah.
God either blessed me or blessed her. You guys pick, but she she would help with more of the emotional, having more heart-to-heart talks, that kind of thing. Getting him dinner and things. I was more the hands-on, cleaning the wound, dressing the wound, making sure we had enough supplies, going to pick up scripts, things of that nature.
Mm-hmm.
But yeah, I mean, nobody ever mentioned anything about it. They never said a word. And that nurse supervisor who called to do our intake, who knew our family so well, she even came over to the home maybe 3-4 times over the 2 years. And I mean, we're just at our wits' end, not because of anything specific to my dad. It was like, we need where's the light at the end of the tunnel here? I mean, you're the healthcare providers. You should be trying to provide resources or information.
Yeah.
And, it was just, to this day, I've never understood why nobody ever mentioned it. And later on, I can tell you how it even made less sense once we started our company.
So tell me about school. Tell me about your marriage during this time.
Good question.
Was that proceeding, or is everything stopped?
It was, marriage was good. I mean, every marriage, you have rocky spots, like, what are we going to have for dinner? I don't want that. I want this kind of thing. But I mean, that was pretty solid. That was very solid. I will tell you, I've had, people say, I can't, my wife would never let my father do, because I mean, all of a sudden, newlyweds, my wife, had, she was already settled in her career, done with college, so we were fortunate in that sense. But, with me, with school, I mean, my whole heart, passion, and desire was medical school. I mean, there was no other option because I wanted to help people. Right. just to give you a little context, like, I don't know if y'all are familiar with Patch Adams.
Yeah.
Oh
Yeah.
yeah.
Okay.
Robin Williams.
Yeah. Yeah.
The movie.
Well,
Sorry,
yeah.
we think immediately movie, not the person.
No. And that's what everybody thinks,
Yeah.
but like, so, I was pursuing, like, I ate, slept, and breathed, medical school, and, brought the oldest medical fraternity in the world to our campus. Then I had this great idea. I said, I want to bring Patch Adams here and have him spend a couple of days with us.
Wow.
And, everybody's like, oh, that's not going to happen. You're nuts. Well, I had written the real life Patch Adams a letter. Maybe 3-4 weeks later, I go to the mailbox. There's a letter and a package from the real life Patch Adams. And I had put my phone number in the letter. I'm like, what do you got to lose? Well, during college, during the summer, colleges are pretty much shut down, right? I mean, for a few classes or whatever, but the labs are not shut down. And so one day I'm on my way to the campus, and I saw I had a voicemail on my phone. This is before Bluetooth and all these other great things. And I listened to it. It was Patch Adams. And I'm like, oh my goodness. And so like, I'm like getting to the campus, because, there's some people there like, oh, he was never going to make it happen and this and that. So I go into the lab and I'm like, everybody come here. And I put it on voicemail and I put it on speaker, and they are just blown away. So really cool, not to go down that rabbit hole, but I have a point to this. I told the university, I said, hey, we could get Patch Adams. And they're like, oh, well, okay, whatever. And I said, but, he's given me his number. We had a great phone call, by the way. And then he told me, reach out to this lady. This is my agent. So I call her. If you guys have ever talked to agents, like, it's like, really not a fun conversation. They're, and she's like, well, this is what Patch needs. This is what he needs. If this is what you're wanting to do. So I said, okay. So I start a big fundraising drive, and the big fundraising drive brought in $0. But I got the university to commit. If I could get half, they would front the other half. So I'm halfway there. And, we knew some my family knew some pretty significant people. So I'm like, I'm going to start hitting them up, because it was going to be, we were going to the hospital for a day. We're going to do this. And then we're going to have 2 public, 1 private, 1 public speaking engagement with Patch. And all of a sudden, Patch calls me like 3-4 weeks later. And I'm like, oh, he's calling me again. This is really cool. So he's like, Lance, how's it going? I said, good. He goes, did you talk to my agent? I said, yeah. He said, what did she tell you? So I told him, and he's like, geez, that's how much she's charging? I'm like, yeah. He goes, well, how much do you have so far? I said, well, to be honest with you, I have got 0. I said, but I'm not going to give up. Don't lose faith. I said, I'm pretty determined person. I said, but the good news is the university's already offered to front, to pay for half of it. He says, really? And I said, yeah. He goes, well, tell you what, I'll do it for the half. He says, you tell the university that that's the price and that I'll do it. And we had this great event, but it was special because, he's talking about a lot of the issues that we were going through with my dad.
Wow.
And my dad had just had surgery, so he wasn't able to be there. But I mean, this event was unbelievable. And it really showed the other side of healthcare and how, if you know his story, he's very personable. It's a remarkable story. And, I'm trying to emulate that with my future career in medicine. And as a subsequent result, I didn't do that route. And now I'm trying to emulate that in my professional career with what I'm doing with our company and, with All Home Care Matters as well, just trying to get resources and support these people, give them a voice and, not have that feeling where you're not being heard and really you're just a, patient in room number 2. And then I'm moving on to my next patient.
Yeah. Wow.
That's okay. So number 1, that's cool.
Yeah.
Oh,
You
it was
like, that's cool.
You miss 100% of the shots you never take. And
Right.
so that's the way that we look at it. And so trust me, I've reached out to a lot of people and I'm like, and every now and then that one responds, I was like, oh, you don't know, I'm like a dog to a bone.
Yes.
So like, you have no clue. Now we're besties. Hey, ladies, I need to interrupt for just a second to share about the Sisterhood membership. It's basically a sale every day. And the best part, it's free. Here's the details. We're partnering with our friends at Benefit Hub and other care partners to save you money. With over 200,000 participating companies across the US and abroad, you'll find discounts at your favorite local stores, huge savings on vacations, amazing deals on home, auto, and supplemental insurances, and everything in between. Go to confessionsofareluctantcaregiver.com to sign up, and then definitely tell your friends about it. They can join too. Trust me, there's a discount for everyone. And don't forget, it's free. Okay, back to confessing. So let me ask you, this is a side question, like a little bit of a side. So I'm assuming that you all, like, us, if you're in college, you're typically poor. You do not have tons of resources and you're not living in a McMansion. And so you're probably living in an apartment or student housing and your dad's coming to live with you. How is it like if you're trying to support him and he's got all these surgeries and things, was your house aging friendly?
You said you guys were making your house payment, so you did have your own home.
We did have our own home. We did have our own home, which was a huge benefit, because if we were in an apartment, it's probably just being my wife and I, we wouldn't have had a 2-bedroom apartment, right?
Right.
So, and we were fortunate that our basement was finished.
Okay.
We had to do some modifications to a room down there, which was kind of like my, office, if you will. And we turned that into a bedroom. And, it wasn't the greatest situation because there were stairs. My dad could ambulate, he could walk, but, it did affect him. He became very weak because of the surgeries. So we would always make sure to help him, up the stairs and things. And, 9 out of 10 times I would help to shower him. Sometimes he would want to do it on his own. And I felt comfortable and confident, he was safe to do it on his own. But yeah, I mean, there was no time to prepare or plan. I mean, we got very lucky that we had space for him. One of the biggest challenges though was having the supplies, and, we didn't have the resources to go and spend, X amount of dollars for, bandages, and, the hospital, the home healthcare, they were good. They would always leave extra supplies here and there, but, it's never enough. Which subsequently, just to kind of piggyback to modern day, that experience left a big impact on me, because we didn't have the resources. If he needed a power chair, how are we going to get that? All these different things.
Yeah.
So we started, for us, it was a ministry, and we had 2 semi-trailers where all these organizations around Michigan, who we developed these really close relationships with over the last, 10, 11 years, they get these donations all the time. Somebody passes away, here's a hospital bed. Somebody passes away, here's a power chair, walkers, shower chairs, cases of unopened Depends. And they have no space for it, and they really don't have a great need to keep all of that on site. So they would call us, they would donate it all to us. And then we're coming into contact with a lot more people than, just one senior center in one community. And so then we can then bless people and say, you know what, we understand, here's a hospital bed. The only thing we ask though is when you're done with it, donate it back to us. If we give them a case of Depends, we don't want those donated back, right? But anything that's reusable, we would sanitize it, scrub it, clean it, the whole 9 yards, and then we can help another family later on who might benefit from it, because we didn't have that. We didn't have that at all.
That's as you started your business. That's kind of your business model. So you got into this, Lance, like you just said, hey, this is where my heart is. Where did that come? You decided not to get your PhD, I guess, or not to get a medical degree. You're not a practicing physician.
Not at all.
You're like, no.
So then what happened? Because somewhere in the 2 years, you get to the end of 2 years, respectfully, because I don't know the answer. Like, what happened to your dad? Did your dad move on? Did he pass? What happened?
About the 2-year mark, that's about the time frame he lived with us, was about 2 years.
Right.
after the seventh, eighth surgery, it got to the point where he needed a lot more medical care
Right.
than what you can anybody could provide in the home, unless you're hiring private physicians and nurses, which
Right.
we did not have the resources for that.
Absolutely.
I would have 110%. I mean, I was in it to the end. I wasn't walking away. I wasn't going to push him off into a facility, but for his safety, and for the needs that he, now had, we had no choice, because it got to the point where they had to cut off part of his tailbone because it was gangrenous with, infection. And I mean, he just ended up, I mean, that infection gets into your bone, it gets into your blood. A lot of unpleasant things starts happening to your body. The part I was most upset with, and again, I can't, you are who you are, and you're brought up the way you are, and you're trained the way you are. So I can't hold it against him in that sense. But it was all avoidable. And that's the part I had the hardest part with. Unfortunately, there are people that have terminal cancer who really didn't have a whole lot of say in if the cancer was, diagnosed or not, but they developed cancer. Obviously, we can all do our part to limit the risk, smoking, tobacco, that sort of thing. But, his was caused from a fall that he developed an abscess. Any one of us could develop an abscess, and it could be cured, treated, and, on your way back to normal. I say stubbornness, but it's more his mentality was, I can beat this, I'm tougher than the illness, I'm tougher than the infection, that kind of thing. And it's not that he avoided taking care of himself. That's not at all what I'm trying to get across here. It was the fact that he thought it was not as bad as it was told, that it would just get better. And, it didn't. It started off, they say faith like a mustard seed. Well, he had an infection like a mustard seed that became a mountain, and that's exactly the best analogy I can come up with. It just continued to progress, and, 8 surgeries. I mean, that in the same area. And I mean, you keep cutting and cutting. And I mean, eventually you're running out of area to cut. Right. And the infection just became overwhelming. It did end up, affecting his brain. It was bad. It was very bad. It was very unpleasant. And it was pretty horrible.
Lance, you said something that hit me. You said you were in it until the end, until you just realized you couldn't care for him fully the way that he needed to really keep him safe. And that was a really hard decision that we came to back in March with Mom. And I know that has been hard, for all of us. But because of the people that you see with what you do, I guess it's not, we want to, it's okay. But can you confidently or, assuringly say to people, sometimes you have to make that decision as hard as it is?
Yeah, at 100%, JJ. We have talked to families who have a loved one with, very advanced aggressive dementia. We've talked to families, pretty much any symptom, illness, condition that you can think of, abilities or lack thereof. And often they will say, we don't want Mom, we don't want our dad, we don't want our son, whatever the situation, to be in a facility. And I do not blame them one bit, but I don't want them to feel guilty if they don't have any other option either, because sometimes that is the safest and the best option, even though it may not seem like it. And we're very real with people, 100%. If we cannot safely and adequately take care of that person in their home or in assisted living, wherever they are that we're caring for them, as a person, as a family member of loved ones, I have a moral obligation, but also a professional obligation to give them that news. And I will say though, fortunately, there have been very, very few cases where we've had to say that. And so now I'll flip it around and say, I'm meeting a family and my dad was their dad or their husband, and we're taking care of him. I've thought about this numerous times. I would have had to have told them I'm sorry, we cannot continue, because it got to the point he needed 24-hour antibiotic or intravenous, access. And, like I said, one, we can't do that professionally. That's not our role. Two, Medicare is not going to pay for that. It just became a point where he had to go into a facility.
Yeah.
I know we're going to inspire and laugh. You want a good laugh, but it's a little scary too. So, the first week or two, now my dad's car, when he had to come live with us, he drove himself to our house. So his car, yeah, I'm telling you, they don't make them like that anymore. He drove himself. So his car was at our house. And when the time came where he had to go into a facility, it was after his last surgery. And I was still holding out hope, talking with his doctor and things, that once he got a little bit stronger and maybe the infection got, a little more under control, he could come back to our house. We're not even talking palliative or hospice at this point. That was the last furthest thing from my mind. My dad was not happy. He wasn't happy about having to live with us, not because he didn't want to live with us. He didn't want to feel like he was imposing and being a bother, all this stuff. So 2 weeks in the facility, I guess, we had a really, tough conversation, and he's like, I'm ready to get out of here. I said, Dad, as soon as you are strong enough, I said, we can't give you IVs at the house. I mean, I've given people IVs, but that was under, a hospital setting and I can't do that for you here. And so, we just said, we're sorry. And he wasn't happy about that. And we were worried he was going to call a friend and, have him break him out. Like, no, dead serious.
We've been there.
Leaving.
We've been there. Yeah.
And so my wife, and this was in December, her company had their, annual, they call it holiday, dare say Christmas anymore. Right. But they had their Christmas party, and we're getting home. Normally, we're pretty early to bed because we get up so early. We get home, it's probably about 10, quarter after 10, she's in the room getting changed and getting ready. I just sit down at the TV just to turn it on. I think I was probably looking for a sports score or something. And I hear a car door, and I'm like, huh. So at first I ignore it. But then I hear another car door, and I'm like, what is going on? So I go to the window, I look out, there is a car pulled in our driveway. Now the headlights are pointed right into our living room. So now I know somebody's here, and I see my dad getting out of the passenger side, and he's getting in his car. And I'm like, I tell my wife, I'm like, you are not going to believe what is going on in our driveway. So, I'm furious because now, it's at the point where I'm like trying to save his life,
right,
because of this infection. And I know, like, if he takes off, we might not figure out where he's at forever.
Right.
And so I run out there. The poor man who dropped him off, I scared him to death because I'm like taking a picture of his license plate, and I got the flashlight staring in his face. And I'm like, Dad, what are you doing? He goes, I'm over it. He goes, I'll go to the doctor. I can take care of this. And I'm like, no, you cannot. We ended up having to call the police because we don't know who this man is that's dropping him off. And that guy, is getting upset because my dad told him he had been discharged.
Oh my gosh.
This poor man. And I'm pretty, cool customer, but I was hotter than anything. And, I think I scared this guy, and my dad gets in his car, and I'm like, you can't go. So the police show up, and I'm explaining, I'm like, look, my dad is very sick. He doesn't want to be in the nursing home. He's under strict doctor's orders. If he goes against medical advice, then he's going to have a massive bill. All these different things. I said, he is very ill. And, so the police, it wasn't like a police 911, but I'm like, I don't know who this man is first and foremost. And I don't know, whatever. And so the police talked to my dad, and he's like, sir, are you going to let your son drive you back there? He said, yeah. Okay. So we go back there. Now I am raising Cain at this facility. I'm like, how is it at 10 o'clock at night, you're letting him walk out of this building? Because after certain hours, the building is locked. It's for safety, because you have people with dementia that wander and all these other things. And they said, well, he said he was going out to the car to meet you for something. And I'm like, I'm like, but here's the thing, you guys, after a half an hour, 45 minutes, you weren't wondering where he was at. Like
Safety check.
if we were not home, if we stayed at that party an extra 15 minutes, he'd have been gone, you know. And so the next morning the administrator calls me, and, you know, because now they're covering themselves very heavily.
That's right.
And they said, we just want to let you know we're contacting the state, we're reporting ourselves, and they're coming to do like all these different things. I mean, it was a big deal. This person, they didn't even know he was gone. So my moral of the story there is, you know, these facilities are so understaffed. You know, some of them are burnt out, you know, they're going through the motions. I mean, we had a facility here in our area about 5-6 years ago. The state came in on a Friday and shut them down, and every family had to have their loved one picked up by like 5 p.m. And I mean, what if you guys had, you know, been out of town and your mom had to be picked up? How are you going to do that? You know, and how are you even getting a hold of families? You know, one lady at that facility that got shut down, she was interviewed on the news, and she goes, I was in my hair salon getting my hair done, and all of a sudden, you know, they just made a news soundbite about it. And she's like, wait a minute, what did they just say? She goes, otherwise I never would have even have known.
Wow.
You know, these facilities need to be held accountable. You know, my father would have died literally if he would have not been found by us that evening, and a sorry wouldn't have cut it for me. You know, sorry. I mean, you know, it's just, you know, the long-term care, healthcare, you know, I respect them, I admire them, but there's so much work that still needs to be done because, you know, they're overworked, they're understaffed, and, you know, insurance makes it difficult to them to really spend the time with these families or these patients like they need to. And I think we all are doing our part to help raise awareness and bring attention to these issues.
100%. Well, and ratios. So when you say understaffed, it's not only understaffed, it's also the impact of the ratios. And when I say ratios, it's one direct care staff member to X number of patients. And how are they being well cared for? X number, you know, I have one RN that maybe during waking hours has 30 individuals or 20 individuals they're responsible for. That's a lot considering these individuals typically take meds. And so, and meds is just a minimum. So no, I completely agree. I think, I worry about the families or the individuals in skilled nursing, that do not have families who are connected, because families, we didn't realize that when our mom went into skilled nursing, that we were the level of oversight, not visit, the level of oversight that was going to be required. And so, in addition to hiring an additional person to come in and to engage with our mom because of what the facility can't do. And I think for me, it doesn't feel right that you're getting paid a reimbursement, a rate to provide care, and you can't even provide the minimum care. Now, I'm not even talking about like, you know, niceties. Like, we're not talking about going into the Marriott here. And so you're welcome, Marriott. And so, but I think those are the things I worry about, and the things I know that we are collectively trying with others, trying to impact change. And
absolutely. Well, and, you know, Natalie, if I could just say real quick, you know, going back to that, you know, we actually met with a family. Well, we were supposed to meet with a lady yesterday. I wasn't the one going, but one of our case managers, because this lady is blind, deaf, lives alone, and she needs significant help. We, when I say we, again, I wasn't there. When our case manager got there, the front door is open, the inside door to the house, because it's like a porch, then enter, you know, and the house is covered in, you know, just, she has a dog. She can't take care of the dog, so the dog is doing its business all over the house. The lady wasn't there. We had no idea where she was at. Neighbors came over and said, oh, are you looking for so and so? Yeah, she ended up going to the hospital yesterday. And then we find out from the neighbors, this poor woman has had the city's fire department at her house 44 times already this year. 40. Where's the continuity? where's the continuity, 44 times, and they're not doing anything to help this poor lady. They're just coming and going. Can't they see the house is covered in, dog, issues? And she's blind, she's deaf, and she lives on her own. You've had to come here 44 times. I would think after maybe the second or third time, they would be reaching out to some sort of services and saying, hey,
Absolutely.
can you? And so, the system is failing our seniors everywhere you look, and I just don't know how to combat it. I mean, we try to use our platform and our voice, but I mean, we're one voice out of billions that are trying to just get these people help. And, this poor lady, like if she falls, and the neighbor said she's so desperate for help, she had her groceries delivered by the Kroger grocery store. And the grocery delivery lady's coming in the house thinking she's just dropping off groceries. And this poor woman's saying, hey, can you change my Depends for me? I can't change them. I don't. And she's like, ma'am, I can't. The neighbors, they all work. They said, we try to do what we can. But, that's why I guess this lady was, calling us. It was actually a local pharmacy had reached out to us because she knew the pharmacist from over the years. And she's asking the pharmacist, will you come do my laundry for me? It's heartbreaking, but there's no support. And the one, entity that was there and was aware of these things that should have some impact for her is this fire department who had been there 44 times this year. And they just keep doing the same thing. So, I mean, what's the definition of insanity?
Oh, doing the same thing over and over again.
Yeah.
A different result.
Amen. Our case manager just, I mean, her heart was broken. She's like, that is so wrong. It is so wrong.
I'll say this, there's so much more that we could talk about. I'm just kind of looking at our time, but there's so much more to be done. And so, especially with this episode, you talked about your own personal experience and how that influenced you into doing something, going a different path. And it's very evident. We'll make sure that you guys, our listeners, have contact information for All Home Care Matters and be able to listen to your podcast because Lance is awesome. Because I think the more that we are aware, the more that we extend education, the more that, we collectively can, it's just one more voice to say this needs to change. And then how do we go about affecting change? So, right now, gosh, I hate to go into sister questions because I just want to talk more about this because I'm like, this is all like social justice and advocacy because that's really what this is, advocacy.
Yeah.
And how do we help our folks from falling into the cracks? I think about the insurance company and does this lady have a care coordinator? I'm sure she does because she has some pretty complex issues, but that's a different story for a different day. And so but know that we'll continue working on it. Jay, I'd love to have you and Em jump in on some sister questions. Em, do you want to start with a sister question
Absolutely.
that you have for Lance?
Oh, she's ready.
Thank you. She is ready.
Absolutely. Like I hear all this and your dad's, all the little adventures he's taking. Did he ever get adjusted to skilled nursing? Did you finally have some peace that he was okay? Because that's what I feel like I'm struggling with.
Yeah. Then you're not going to like my answer, Em.
We like reality therapy.
Thank you.
Truthfully, he did not ever adjust. I tell families all the time, putting somebody in a facility is not really alleviating your emotional connection, or I say, quote unquote, caregiver guilt. I ended up going there twice a day until he passed. That doesn't mean your mom would not adjust. I'm just saying for my dad, he never did.
Yeah.
He felt like he was being imprisoned against his will. And that was very hard for me, because, I was kind of the brunt of that, anger, not
Right.
in a bad way. I mean, but in the sense that, like, Dad, if I could do it any other way, I absolutely would. I mean, I would bring you back home now, but this is for your safety. This is for your best interest. And we, like I said, I went twice a day, every day until he passed. He passed about a year and a half later.
Wow.
And, just, when he passed, it was about 5 a.m. in the morning, the facility called. And, and these facilities, I'm sorry, they're not all bad, but they're not all great either.
Right.
They called and said, well, I thought you might want to know that, your dad might be passing soon if you wanted to stop by. Now, this place knew me inside and out, and I knew it inside and out. And sometimes these facilities have people that are basically taking these jobs because they're not able to cut it. I'm sorry, in a hospital type setting, they can't handle it. Or they're kind of washed out and they're just getting a paycheck. Why would you not think I want to be there? Right. I'm there every single day, twice a day. And so, I get there and, false alarm. So he was fine. So I go home, but then it was about 3 months later, same thing. Well, I thought maybe I should call you. Well, yeah. I was able to
Captain
be
Obvious.
there. Yeah. So I was very thankful I was able to be there when he passed. And, but again, my resentment in all of this is it never had to be that way. It just never had to. And I would tell I'm like, look, you don't have cancer. You don't have this, you don't have that. I said, you are so fortunate. People that have these other very terminal, less than, positive outcome diagnosis, they would love to be in this situation. I said, just take care of it. Let's just, and then let's get you back on your feet and, move on. And he just, to the very end, he just did not think it was that serious. And I couldn't slay that beast as much as I tried.
No. I don't think you were. I don't think you were going to be able to.
No,
Mindset.
Yeah. But, we have this in common. I also had the mindset that I could, and, rightly or wrongly, but I had to have that mindset, or else otherwise, to me, that was like, I'm just giving up. Then, let him do whatever he wants to do, so that, I never, I felt good, that I made the right decision, because if he had stayed in our home, we wouldn't have gotten those extra 2 years or so, whatever it ended up being. But I felt bad that it had to come to that too, though.
Yeah. Well, you know what, Lance, we appreciate you being here, sharing your story, sharing these nuggets of wisdom. I think it's so important. I think, I keep coming back. I've heard you repeat it. It didn't have to be this way. And so I think, that's our takeaway, and along with the other kernels of information that you've given us. Lance, thank you so much for being here with us. I feel like JW&M, we got to have him back. So
absolutely
100%. So guys, thank you so much for listening in to our episode. And until we confess again, we will see you next Tuesday. Thank you.
Thank you.
Bye.